Have you ever considered that your lifelong bathing habits might actually be accelerating your skin's aging process? For women over 70, this isn't just a cosmetic concern. It's a matter of skin health and overall well-being. As we age, our skin undergoes remarkable changes. It becomes thinner, drier, and significantly more fragile, almost like delicate tissue paper compared to the resilient canvas of our youth. According to Dr. Zoe Draelos, a board-certified dermatologist and research scientist with over 30 years of experience studying aging skin, the natural oil production in elderly skin decreases by up to 60% compared to younger adults. Daily bathing with soap can strip away these precious remaining oils, compromising the skin barrier. A landmark study published in the Journal of Dermatological Science found that women over 70 who their bathing frequency from daily to 2-3 times weekly showed a 35% improvement in skin hydration and a significant reduction in itching and flackiness within just 1 month. Take Martha, a 76-year-old former teacher from Boston. "I'd been showering every single day for decades. It was just what I always did," she shares. "But my skin was becoming increasingly dry and irritated. My dermatologist suggested cutting back to 3 times a week, and I was skeptical. Within 3 weeks, the difference was remarkable. My skin stopped flaking, the itchiness subsided, and my daughter even commented that my skin looked more radiant." So what's the ideal approach? Dermatologists now recommend that women over 70 bathe fully only 2-3 times per week. On other days, a targeted cleansing of essential areas, underarms, private areas, and feet, is sufficient to maintain hygiene without compromising your skin's natural defenses. When you do bathe, opt for lukewarm water rather than hot, limit your time to 5-10 minutes, and choose gentle, fragrance-free cleansers specifically formulated for sensitive aging skin. Follow immediately with a rich moisturizer while your skin is still slightly damp to lock in hydration. Remember, what worked for your skin at 40 may be harming it at 70. Adapting your bathing routine isn't about lowering your standards. It's about giving your changing skin exactly what it needs to stay healthy. We've been taught since childhood that cleanliness prevents illness. But what if I told you that for women over 70, too much bathing might actually increase your risk of infections? This counterintuitive fact is backed by fascinating scientific research. Your skin isn't just a passive barrier. It's a living ecosystem home to trillions of beneficial microorganisms that form your skin microbiome. Dr. Elizabeth Grice, microbiome researcher at the University of Pennsylvania School of Medicine, explains, "This diverse community of bacteria, fungi, and other microorganisms acts as your first line of defense against harmful pathogens. When we over-bathe, especially with harsh soaps, we disrupt this protective ecosystem." A 2022 study published in the Journal of Clinical Medicine examined the skin microbiome of adults over 70 and found that those who bathed daily had significantly less microbial diversity compared to those who bathed 2-3 times weekly. This reduced diversity was associated with a 40% higher incidence of fungal infections and dermatitis. On visual cue, simple animation showing how beneficial bacteria protect skin from pathogens. Consider the difference between being clean and being sterile. Your skin needs its healthy microbes. They produce antimicrobial substances that fight off harmful bacteria, maintain proper pH levels, and even help strengthen your immune response. When you wash them away too frequently, you create a vacuum that opportunistic pathogens can fill. "I was getting recurring fungal infections between my toes despite showering twice daily," shares Catherine, 81. Her podiatrist explained, "I was actually washing away my skin's natural defenses. After switching to gentler products and bathing less frequently, the infections stopped completely." For optimal skin health, consider pH-balanced, soap-free cleansers specifically formulated for sensitive skin. Look for products containing prebiotics that support your skin's beneficial bacteria, rather than stripping them away. What's your current bathing routine? Has it changed as you've gotten older? Share your thoughts in the comments. I'd love to hear about your experiences and answer any questions you might have. That steaming hot shower might feel heavenly, but for women over 70, it could be surprisingly dangerous. The comfort of hot water comes with significant risks that many of us never consider until it's too late. When you step into a hot shower, your body responds immediately. The heat causes your blood vessels to dilate rapidly, a process called vasodilation. Dr. Eleanor Thompson, geriatric specialist at Mayo Clinic, explains. This sudden dilation can cause blood pressure to drop precipitously in older adults, whose cardiovascular systems don't adjust as quickly as they once did. This phenomenon, called orthostatic hypotension, can lead to dizziness, disorientation, and dangerous falls. The statistics are sobering. According to the Centers for Disease Control and Prevention, over 235,000 adults over 65 visit emergency rooms annually due to bathroom-related injuries, with 81% of these incidents occurring during bathing activities. The combination of slippery surfaces, steam, and sudden blood pressure changes creates what Dr. Thompson calls the perfect storm for serious injury. I've treated countless patients who experienced falls after hot showers. Dr. Thompson continues. One moment they're enjoying the warmth, the next they're feeling lightheaded, and before they can react, they've fallen. For older adults, these falls often result in fractures that can permanently impact mobility and independence. Margaret, 75, shared her experience. I loved my scalding hot showers until I blacked out and fractured my wrist. My doctor explained that what felt good was actually dangerous at my age. Now I keep the temperature moderate, and I've installed grab bars that give me confidence. The ideal water temperature for seniors is between 98–100 F 373 degrees C, warm enough to be comfortable and help muscles relax, but not hot enough to cause vasodilation and blood pressure drops. A simple bath thermometer can help you find this safe range. Other essential safety measures include installing grab bars near the shower and toilet, using non-slip mats, considering a shower chair, and keeping emergency alert systems within reach. If you do feel dizzy while showering, sit down immediately if possible, or carefully lower yourself to minimize injury risk. Remember, bathroom safety isn't about limiting independence. It's about making small adjustments that allow you to maintain your routines safely for years to come. While many of us dedicate considerable time to facial skincare routines, our feet, especially after age 70, often don't receive the attention they desperately need. This oversight can lead to serious health complications that extend far beyond mere discomfort. As we age, circulation to our extremities naturally decreases. Dr. Robert Jenkins, podiatrist and fellow of the American College of Foot and Ankle Surgeons, explains, blood flow to the feet can decrease by up to 40% by age 70, significantly impairing healing ability. What might be a minor cut in your 40s can become a persistent wound in your 70s. The American Diabetes Association reports that proper foot care reduces the risk of complications by 50–60% in older adults. Even without diabetes, seniors face similar risks due to reduced sensation and circulation. I see it regularly in my practice, Dr. Jenkins continues. A tiny crack between the toes goes unnoticed, becomes infected, and suddenly we're dealing with a serious issue that could have been prevented with basic daily care. Barbara, 78, learned this lesson firsthand. I'd always ignored my feet until I developed a fungal infection that spread to my toenails. It took months of treatment to resolve. Now, checking my feet is as routine as brushing my teeth. Here's a simple yet effective daily foot care routine. First, wash your feet daily with warm, not hot, water, even on days you don't take a full bath. Use a gentle cleanser rather than harsh soap. Pay special attention to the areas between your toes where moisture can collect. Second, dry thoroughly, especially between the toes. Patting rather than rubbing prevents skin damage, and ensuring complete dryness discourages fungal growth. Third, moisturize the tops and soles of your feet immediately after drying, but avoid applying lotion between toes where extra moisture can promote infection. Finally, perform a daily visual inspection. Look for any changes in color, temperature, or texture. Use a hand mirror if bending is difficult, or ask a family member for help. Report any cuts, blisters, or color changes to your healthcare provider promptly. Remember to check your feet daily for any signs of problems. Early detection of issues can prevent serious complications down the road. Has foot care been part of your regular routine? I'd love to hear your experiences in the comments. Let's address a topic that's rarely discussed but critically important for women over 70, the proper care of your intimate areas. Many women continue using the same hygiene practices they've followed for decades, unaware that these methods may now be causing more harm than good. After menopause, your intimate tissues undergo significant changes. Dr. Sarah Johnson, gynecologist specializing in geriatric women's health at Northwestern University, explains, estrogen levels drop dramatically, causing vaginal tissues to become thinner, less elastic, and more fragile. The vaginal pH also shifts from acidic to more neutral, reducing natural protection against infections. These changes make your intimate areas more susceptible to irritation and infection. A study in the Journal of Women's Health found that 68% of women over 70 experience at least one episode of vaginal irritation or infection annually, often exacerbated by improper hygiene practices. The most common mistake I see in my practice is women using scented soaps, bubble baths, or douches, says Dr. Johnson. These products disrupt the delicate balance of vaginal flora and can cause significant irritation to already sensitive tissues. One patient, who preferred to remain anonymous, shared, "I'd been using the same floral, scented soap for 40 years. I was constantly dealing with irritation and recurring infections. When my doctor suggested I stop using soap entirely on my intimate areas, I was shocked. Within 2 weeks of washing with just warm water, all my symptoms disappeared." For optimal intimate hygiene after 70, remember these evidence-based guidelines. The vagina is self-cleaning. Focus only on gently washing external areas with warm water or pH-balanced cleansers specifically formulated for intimate use. Avoid internal cleansing or douching, which disrupts natural flora. Use your hands rather than washcloths, which can be abrasive on delicate tissues. Pat dry gently rather than rubbing, and consider using a hair dryer on the cool setting if mobility issues make thorough drying difficult. If you experience persistent dryness or discomfort, talk to your healthcare provider about safe moisturizers designed specifically for vaginal tissues. Over-the-counter options without parabens or glycerin can provide relief without disrupting your natural balance. Remember that odor changes are normal with age, but strong or fishy odors may indicate an infection requiring medical attention. Proper hygiene supports your body's natural defenses rather than working against them. Have you noticed that despite your best skincare efforts, your skin still feels dry and irritated after bathing? The culprit might not be your products or routine, but something flowing right from your tap. Hard water. Hard water contains high concentrations of dissolved minerals, primarily calcium and magnesium. While these minerals aren't harmful to drink, they interact with your skin in ways that can be particularly problematic for women over 70. Dr. Patricia Wexler, dermatologist and researcher at Mount Sinai Hospital, explains, "When hard water comes in contact with soap, it forms an insoluble precipitate, what we call soap scum. This residue doesn't rinse away completely, instead remaining on the skin as an invisible film that blocks moisturizers from penetrating and irritates sensitive aging skin." A comprehensive study published in the Journal of Dermatological Science found that regions with harder water reported 27% higher incidence of eczema and contact dermatitis among seniors. The minerals in hard water disrupt the skin's natural barrier function, making it more permeable to irritants and allergens. "I moved to a new city at 72 and suddenly developed itchy, scaly patches on my skin," shares Elaine, 78. "After trying countless creams and medications, my dermatologist suggested testing my water. It turned out to be extremely hard. Installing a simple shower filter made more difference than all the expensive creams I'd tried." Here's a simple test to determine if you have hard water. Fill a clear bottle halfway with water from your tap. Add a few drops of pure liquid soap, not detergent, and shake vigorously. If the solution forms minimal suds with a milky or cloudy appearance, you likely have hard water. Fortunately, you don't need an expensive whole house water softening system to protect your skin. Affordable shower filters that attach to your shower head can remove up to 90% of chlorine and reduce mineral content significantly. Look for filters containing KDFs, kinetic degradation fluxion media, which are particularly effective at reducing minerals. When bathing in hard water, choose specially formulated, hard water cleansers that contain chelating agents to prevent mineral deposits on skin. After bathing, apply moisturizer immediately, within 3 minutes, while skin is still slightly damp to trap moisture before the hard water residue can fully set. For hair care, consider using a clarifying shampoo once weekly to remove mineral buildup, followed by a deep conditioning treatment to restore moisture and shine. Have you noticed a difference in your skin when traveling to areas with different water? I'd love to hear about your experiences in the comments. As we age, finding restful sleep can become increasingly elusive. If you've been tossing and turning at night, have you ever considered that your bathing routine might hold the key to unlocking better sleep? A warm bath before bed can be a simple yet powerful solution. Research from the National Sleep Foundation indicates that a warm bath can help signal your body that it's time to wind down. Dr. Michael Breus, a clinical psychologist and sleep specialist, explains, when you soak in warm water, your body temperature rises. As you step out, your core temperature drops, mimicking the natural cooling process your body undergoes when preparing for sleep. This drop signals the brain to release melatonin, the hormone responsible for regulating sleep. A study published in the Journal of Clinical Sleep Medicine found that participants who took a warm bath 1-2 hours before bedtime fell asleep faster and experienced deeper sleep compared to those who did not. The ideal wadding relaxation is around 98-100 degrees F, 37-30 degrees C, warm enough to be soothing but not so hot that it causes discomfort. Consider this: a warm bath not only aids in relaxation but can also help ease muscle tension and joint stiffness, common complaints as we age. By immersing yourself in warm water, you create a soothing environment that allows your body to unwind after a long day. To enhance this sleep-inducing ritual, you might add calming elements to your bath. A few drops of lavender essential oil can heighten relaxation. Studies show that lavender can lower heart rate and promote feelings of calm. Soft lighting and gentle music can further create a serene atmosphere. However, timing is crucial. Aim to finish your bath about 1-2 hours before you plan to sleep. This window gives your body enough time to cool down, maximizing melatonin production and preparing you for a peaceful night. If you've tried warm baths before bed, I'd love to hear how they've impacted your sleep. Share your experiences in the comments, and let's continue to explore ways to enhance our health and well-being together. It may surprise you to learn that your bathing habits can significantly impact your heart health, especially as you age. For women over 70, understanding this connection is crucial for maintaining cardiovascular wellness. When you immerse yourself in hot water, several physiological changes occur. Dr. Alice Thompson, a cardiologist specializing in geriatric care, explains, hot water causes your blood vessels to dilate, which can lead to a drop in blood pressure. For many older adults, whose bodies may not adjust quickly to such changes, this can result in dizziness or fainting. A study from the American Heart Association revealed that sudden changes in temperature, like stepping into a hot bath, can trigger a rapid heart rate and even arrhythmias in susceptible individuals. This is particularly concerning for those with existing heart conditions or hypertension. Take the case of Mary, an 82-year-old woman who loved her long, hot baths. I never thought twice about it until I fainted in the bathroom. My doctor explained that my heart was working too hard to adjust to the heat, which put me at risk, she recalls. After adjusting her bathing routine, she now enjoys warm baths and monitors her time spent soaking. So, what can you do to bathe safely while protecting your heart? First, aim for a water temperature between 98-100 degrees 37-30 degrees C. This range is warm enough to enjoy the benefits of relaxation without putting undue stress on your cardiovascular system. Limit your bath time to 10-15 minutes and avoid sudden changes in position. When getting out, rise slowly to allow your body to adjust, and consider using grab bars for support. If you have any heart issues or experience symptoms like dizziness or shortness of breath during bathing, consult your healthcare provider before making any changes. They can provide personalized advice tailored to your health needs. Bathing should be a relaxing experience, not a source of risk. By making informed choices, you can enjoy your bathing routine safely while prioritizing your heart health. What adjustments have you made to your bathing routine for better health? Share your thoughts in the comments below. We've explored 8 remarkable facts about bathing after 70 that challenge conventional wisdom and highlight the unique needs of aging skin. Let's bring these insights together to create a practical approach that balances hygiene, comfort, and health. The science is clear: as we age, our bodies change, and our self-care routines must evolve accordingly. Dr. Helen Morris, Director of Geriatric Medicine at Columbia University Medical Center, emphasizes, personalized bathing routines are essential for older adults. What works for a 40-year-old rarely serves a 75-year-old well, and what works for one 75-year-old may not work for another. Based on all we've discussed, here's an ideal bathing framework for women over 70 that you can customize to your needs. For most women, full body bathing 2-3 times weekly with gentle, fragrance-free cleansers strikes the perfect balance between cleanliness and preserving your skin's natural defenses. On non-bath days, a targeted cleansing of essential areas maintains freshness without compromising skin health. Water temperature matters tremendously. Aim for lukewarm to 98-100 F rather than hot, and limit bathing time to 10-15 minutes to prevent excessive drying and cardiovascular stress. After bathing, apply moisturizer while your skin is still slightly damp, within 3 minutes, to lock in hydration. Pay special attention to your feet and legs, where dryness often strikes hardest. For those with specific health conditions, these guidelines may need adjustment. If you have diabetes, daily foot inspection becomes non-negotiable. For those with heart conditions, shorter bathing sessions and cooler water temperatures may be necessary. Remember that these recommendations aren't about lowering your standards. They're about giving your changing body exactly what it needs to thrive. As Dorothy, 84, shared with me, when I finally stopped fighting my aging skin and started working with it instead, everything improved. I feel more comfortable, my skin looks better, and I've stopped wasting money on products that were actually making things worse. I hope these insights help you develop a bathing routine that supports your health and comfort in your golden years. Every woman's journey is unique, and finding what works best for your body is a form of self-care that pays dividends in comfort, health, and confidence. What changes will you make to your bathing routine after learning these facts? Share your thoughts in the comments. I'd love to continue this conversation with you and learn from your experiences as well. Welcome to Nourish Now, where we explore evidence-based approaches to aging gracefully and comfortably. I'm Dr. Rebecca Stevens, and today we're tackling a topic that might surprise you: how your bathing habits could be affecting your health and longevity after age 70. Many of us grew up with the notion that daily bathing is essential for good hygiene. But what if I told you that for women over 70, this well-intentioned habit might actually be harming your skin, increasing infection risk, and potentially creating other health complications? The science on this topic has evolved significantly in recent years, and today I'll be sharing 8 evidence-based facts that might completely change how you approach your bathing routine. Before we dive in, I want to emphasize that this information comes from peer-reviewed research and clinical expertise. As a board-certified dermatologist with over 25 years of experience working with aging skin, I've seen firsthand how small adjustments to bathing habits can dramatically improve skin health and overall comfort for my patients. This video isn't about lowering your standards of cleanliness. It's about understanding how your body's needs change with age and adapting your self-care routines accordingly. The goal is to help you feel more comfortable in your skin while maintaining optimal health. Throughout this video, I'll be sharing not only scientific findings, but also real stories from women who have transformed their bathing routines and experienced remarkable improvements in their skin health and overall well-being. I've also consulted with specialists in geriatric medicine, cardiology, and podiatry to bring you comprehensive, holistic advice. Each of the 8 facts will explore challenges conventional wisdom in some way, but I encourage you to keep an open mind. What worked for your skin at 40 or 50 may not serve you well at 70 or 80, and making informed adjustments can significantly enhance your comfort and health. I invite you to watch until the end, as each section builds on the previous one to create a complete picture of optimal bathing practices for women over 70. If you find the information valuable, please share your thoughts in the comments section. I'm genuinely interested in hearing about your experiences and answering any questions you might have. Now, let's explore our first jaw-dropping fact about bathing after 70, which concerns the surprising relationship between bathing frequency and skin aging.